Sunny 95.
Welcome to The Reasons We Smile with Dr. Kvitko, the show that brings you man-on-the-street interviews, celebrity guests, groundbreaking research, and heartwarming stories about the reasons we smile. Our show is also known as everything you've always wanted to know about dentistry, but were too numb to ask. Hello, I'm General Dentist Dr. Kvitko, and thank you for joining me today.
The following views and opinions do not necessarily reflect those of this station, its staff, management, or parent company. To hear a replay of this show or one of the great shows that previously aired, log on to thereasonswesmile.com or iTunes, keyword Dr. Kvitko or The Reasons We Smile. Listeners should not use Dr. Kvitko's comments and advice in place of an actual dental exam.
Brighten your life with a smile that shows the professional touch of Dr. Kvitko.
Time now for The Reasons We Smile with Dr. Kvitko. Call 459-9769 to discuss your dental issues. Now, here's your host, Dr. Kvitko.
Hello, everyone. Welcome to The Reasons We Smile. I'm Dr. Kvitko. Thank you so much for joining me. This is episode number 555, and the title of today's show is that we are bringing you 10 signs you need to see your dentist ASAP. 10 signs you need to see your dentist as soon as possible. All right, before we get started, let me remind you, if you'd like to follow me on Twitter, it's at Dr. Kvitko, or if you would like to go to my office Facebook page, or both, by the way, it's Dr. Kvitko and Associates. Maybe you can like us once you get there. All past episodes, complete with video, are available at thereasonswesmile.com, and we are streaming live on Facebook, so I'll just wave to the Facebook folks. All right, so as I mentioned, 10 reasons, or 10 signs you need to see your dentist as soon as possible. This comes from an article written by Angela Isles, okay? And so, the first one is tooth pain. Now, that might seem obvious, but you'd be surprised because a lot of people that have tooth pain do things like stick an aspirin in the tooth and do things like that, home remedies that don't seem to work and can just make it worse. And by the way, so you know what? We all know that we should go to the dentist every 6 months, and we've been told that since we were kids. It's something that so many people fail to follow through with as adults, visiting the dentist on a regular basis. So whether you choose to blame a busy work schedule, a hectic family life, or a demanding social schedule, one thing's for sure, we should all make time for the dentist, or we might seriously regret it later in life, and I see that every day. Also, just because you brush your teeth twice a day and floss a few times a week, it doesn't mean that you're exempt from making a visit to the dentist. If your teeth aren't properly cleaned at least once a year, you run the risk of serious health issues like gum disease, coronary artery disease, and dementia. If you think you've waited too long to visit the dentist, you probably have. And chances are you've probably recognized at least one of the following symptoms of poor oral health. If you're experiencing any of these signs below, you would need to make a dentist appointment right away. Okay, so we mentioned tooth pain, which is actually pretty hard to ignore. When a toothache hits, are you willing to do anything to get it treated? It's obviously there's something wrong, and if you're experiencing tooth pain, but it might be more serious than you think. Even if the pain resides after, even if it goes away after a day or two, you still need to see me. Your body may have fought off the infection, but the root cause often still remains. Now, you might remember last week's show we talked about fistulas. And by the way, fistulas are not on this woman's list, Angela Isles, the author of what I found online. But we're gonna make it 11. And I just wanted to give you an update on that show because guess what? Over the weekend, after I did the show last Sunday, I got an email it's a text from my answering service. And it says, I'll make up a name. It's like, let's see. We'll just go with John Smith. Okay, gives his phone number. And it says, Dr. Kvitko, I had a tooth pulled a couple years ago, and now I'm experiencing bleeding and pus coming from the tooth and slight pain. Please call me. I need to make an appointment. So I looked up his x-rays, and I could see that a year ago we'd taken out the second to last upper left tooth. It was a molar. It was all broken down. You could see all the infection up in there. The one behind it had a root canal. So it looked like the issue was emanating from this tooth. And we took it all out, cleaned it up, and let it heal, and everything was fine for about a year. So when he comes in and I take his x-ray, what did I see? I saw this huge kind of darkened area on the x-ray that looked like this time it was emanating from the tooth behind and working its way out of the hole where the tooth had been, the one that we extracted. So I knew right away that what this was that granulation tissue, that material that grows when the body's trying to heal. It knows it has an issue going on, but it doesn't know how to fix it. So it just grows this gum tissue called granulation tissue. And I told him on the phone what he'd be coming for. He'd be coming for having us, I'd have to make an incision, pull a flap up, clean out all of that material, sterilize it with my laser the best I could, and then pack bone particles in there, donated bone, it's actually cow bone, bovine bone. And then we would cover it up with some collagen, stitch it up tight, and let it heal. So his was huge. It was one of the biggest ones I've seen. Right after I did the show about fistulas, which was kind of ironic, I guess. And, it's like I said, it's not even one of the 10 that we're talking about. But I just wanted to give you that update. Okay, so pain. We talked about pain. Pain's a big one. And don't do one of the at-home treatments. Don't put an aspirin there. You know what that does? Burns the tissue, makes you think your toothache went away. Instead, you're just thinking about your sore gums now. Aspirin is acetylsalicylic acid. It's acid. So if you're putting acid on top of a cavity, you're just going to make it worse. So you have to be careful about that. Some of these old wives' tales actually have some merit, but this one doesn't. So don't do that. Okay. The next one of the 10 is inflamed gums. So inflamed gums, if your gums are swollen and inflamed, you definitely need to book an appointment with your dentist or with me. Inflamed gums are caused by hardened plaque that has accumulated under your gum line. They can often be a sign of gingivitis or periodontitis, which is a more advanced condition, which can lead to tooth loss if not treated early enough. Okay, so you'll see there's this process where when your gums get inflamed, they get inflamed. The inflammation is this reddening, and the reddening comes from more capillaries. So when your body detects an issue, it decides, let's see if we can carry this away through the plumbing system, so we'll grow some more plumbing. We'll grow some more capillaries. And that's why your gums bleed. So that's the first sign that you have an issue. Now, we saw a patient, let's see, it was on Thursday last week, and this gentleman, nice gentleman, he hadn't been to a dentist in a long time. He had so much calculus on his teeth, and by the way, we call tartar calculus. It's calcified plaque. That's where the word comes from. So, anyway, he had so much calculus on, no, it was Wednesday, that's right. He had so much calculus on his teeth, we couldn't possibly even try to get that in one appointment. And in fact, let me just make a distinction here. People say, I just want a cleaning. Well, a cleaning is essentially the teeth, the parts of the teeth that you see, and about 3 millimeters below the gum line. Not onto the roots, just the crowns of the teeth. Okay, just the crowns. Everything above what we call the CEJ, the cemento-enamel junction, which is where the enamel, which is of the crown part, comes together with the cementum, which covers the root. So, folks, I want you to listen to this. This is very important. I can't tell you how many times I've either heard the story from a patient that told me about another office, or I'm having to explain it to them, and they're saying, no, I just want a cleaning. If you have gunk below that CEJ, you do not need just a cleaning. Because in order to get it down onto the root surface, it's called root planing and curettage. And it takes longer, it costs more, and we usually numb people for it because we don't want to hurt anyone. Okay? So don't go to your dentist for just a cleaning if it's been years, or even if it's been, a year instead of just 6 months. You're going to need, almost all of you, not everyone, but almost all of you are going to need root planing and curettage. Don't think the dentist is trying to pad their pocketbook or make a boat payment. They're not. They're just trying to get you healthy. Okay? So, that's important. It's very, very important to remember. So, inflamed gums then tell you that you either have plaque on your teeth, calculus on your teeth, or you already have periodontal disease, which means in this gentleman's case, he had a periodontal abscess where he'd lost half the bone on his upper front tooth. There was pus coming out of it. He didn't know it. It wasn't hurting, but there was pus coming out of there, and then he has another couple teeth that we might be able to save, or we may not. Okay, and all of this was quietly happening while he thought everything was fine. Okay, so that's very, very important. So that was inflamed gums. The next one is sensitivity to hot and cold. So if you're experiencing sensitivity to hot and cold, see, when decay first occurs, it affects the surface of your teeth, and as that condition advances, it makes its way into the center of the tooth where the nerves and blood vessels are located. This is when you start experiencing pain in response to hot and cold temperatures. If you're experiencing these symptoms, book a dental appointment immediately to get your cavity filled. The earlier you treat a cavity, the less likely it is to develop into something more serious, which is most likely a root canal. Sometimes it's an extraction. We just can't get far enough. We just can't, it's so far gone. I mean, if the decay has eaten away at the tooth so much so that it's almost sectioned it into a couple roots, it's already kind of broken in half, if you will, well, there's nothing that we can do but take it out, put bone particles in, bone grafting, and place an implant, or make you a bridge if that's all you want. So these things can be managed very easily if you just come in and you have us check on a regular basis. That's every 6 months. And I take x-rays on adults once a year, the bite wing x-rays. I take a full series on adults every 3 years. And this past week, I saw, I don't know if it was in the same patient or not, but there was a patient that came in. They have internal resorption on an upper cuspid. Might have been the same man. Internal resorption, external resorption. That is like the body saying, we think this tooth or we don't think this tooth is supposed to be here. We think it's a foreign object. At some point, the body got confused and started attacking a tooth. It can attack it from the outside in or the inside out. And although some dentists will try to do a root canal and see if that'll work, it almost never does. So I'm willing to try it if the patient wants to do, that last-ditch effort. But in most cases, it winds up being extracted anyway. And so a lot of times we'll just say, you know what, let's just skip the root canal. Let's just take the tooth out. Let's just pack some bone in there, get ready for an implant. We'll make you a temporary partial that you'll wear in the meantime. And it takes about 9 months on an upper, about 6 months on a lower, from start to finish, before you will have that finished crown, the one that looks really nice. Okay? So, anyway, yeah, it's very important. So, we talked about the cold things, and I just want to make sure that I'm covering everything, because if you didn't already know, at about 10 minutes into the show, which we're getting close to, we do Dr. Kvitko's question of the day, and we always like to make sure that I've covered everything before we do the contest, because that wouldn't be fair, right? So I'm not going to have time to go into this next one, which is white spots on your teeth. That's going to be one reason why you're going to want to see your dentist right away. But we'll just kind of recap. Pain, inflamed gums, and white spots on your teeth are going to help you have the correct answer to Dr. Kvitko's question of the day, all right? So I think let me just give you the phone number. We'll pre-program it so you can pre-program it into your phone, 614-459-9769. 614-459-9769. That's going to be the number you're going to call here in a couple minutes when we do Dr. Kvitko's question of the day. But before we do, we'd like you to listen to this.
This station will not be held liable for any contesting during The Reasons We Smile with Dr. Kvitko. Participation in the contest allows Dr. Kvitko to record and broadcast your name and call. One winner per household. Prizes are non-transferable, cannot be substituted, and are subject to taxes and fees. This station cannot be responsible for the inability to enter the contest, whether due to equipment malfunction or telephone difficulties. All decisions of Dr. Kvitko concerning this contest or eligibility are final.
And now it's time for Dr. Kvitko's question of the day.
All right, today we are bringing you 10 signs you need to see your dentist as soon as possible. Which of the following are some of those reasons? A, pain. B, inflamed gums. C, white spots on your teeth. Or D, all of the above. All right, the winner's going to receive free flowers from DeSantis Florist. They'll be delivered to your place of business this Tuesday afternoon. The number to call is 614-459-9769. That's 614-459-9769. So go ahead and call now.
You won't believe it though. I want to hear your mind. And there's nothing else in the world tonight. She said people don't take the time. Hey, people don't take the time.
Hi, I'm Keith Carlos, winner of America's Next Top Model and star of Chocolate City 2. Look for my smile on the big screen this summer, courtesy of Dr. Kvitko. Stay tuned to The Reasons We Smile with Dr. Kvitko, the world's most interesting dentist.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow.
Did you know that you no longer need to visit several different dental professionals to get more complete dental care? We handle everything from cleanings and orthodontics to restoration, implants, and smile makeovers, all in my office. And now we have 2 locations. Get the most advanced technology and procedures available today. It's more complete dentistry.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
Dr. Kvitko! Let's go!
Hi, this is Richard Simmons. Dr. Kvitko's here, and he's going to help you with all of your problems. Are your teeth yellow? He can fix that. Are you missing a tooth? He can put a new one in. How is that?
That's very good. Thank you, Richard. All right, we're back. We're doing Dr. Kvitko's question of the day, but we don't yet have a winner. I'm thinking some of you think the show is pre-recorded and so the phones aren't live, but they're live. I'm here sitting in the studio. You could drive by and wave in the window. And so if you've never called in or you think you want to have a better chance of winning some free flowers, the number 614-459-9769. 614-459-9769. Let me just restate the question. It's pretty easy. Today we're bringing you 10 signs that you need to see your dentist as soon as possible. Which of the following are some of those reasons? A, pain. B, inflamed gums. C, white spots on your teeth. Or D, all of the above. I think you should know that it's all of the above. Okay, anyway. 614-459-9769. You'll get some free flowers from DeSantis Florist. In the meantime, I'm going to move on to some of the others. Now the white spots on the teeth, those can be the first signs of dental decay. I said I would get to those after the break. Dental decay is an infection in your teeth where enamel begins to dissolve in response to acid produced by bacteria. Tooth decay can often occur with no symptoms, especially at the beginning, which is why regular dental appointments are critical. Okay, so it is very important, and a lot of times if you've had braces, those of you that have braces, you'll know that with the brackets on there, you start to get these little white chalky spots, and that's oftentimes the beginning of decay. All right, so it looks like we have a caller calling in to win the flowers on line 2. Who would that be? We'll find out. What's your name, please? Hello? Whoop, I don't hear them. Maybe they don't hear me. Oh, he's going to push a button. Push the magic button. So far not working. Oh, is that it? Are you there? Hello?
Yes, I'm here.
Oh, good. What's
Hello.
your name? What's your name?
Sandy.
Hi, Sandy. Do you have the answer to Dr. Kvitko's question of the day?
I'm going to say all of the above.
That is correct. That is correct. Did you know that anyway? You didn't really need me to tell you, did you?
I didn't know about the white spot.
Oh, okay. Now you do, because
So-
I was just saying that they turn into decay like around braces, right?
Yeah, thank you.
Okay, well, hey, Sandy, stay on the line. What do you do for a living? I always ask folks.
I'm retired, but I also work out of my home, self-employed for Avon and Young Living Oils.
You have a young-sounding voice to be retired. Wow. You must look young,
Yep.
too. You do, don't you? Yeah, you've said that. People said that before.
Yes, I do.
Hey, well, you keep smiling, okay? And help those women
Yes.
smile. Thank you, Sandy. Stay
Yes.
on the line. We have to get the address where to send the flowers.
Okay, thank you very much.
You're welcome. Thank you. Okay, so congratulations to Sandy, and she'll get those flowers from DeSantis. And those of you that thought you should call in and forgot or didn't, you can call in next week because we do this every week. Okay, now we talked about sensitivity to hot and cold, and so now we've covered 4 of them, 4 of the 10. And just to recap, it was pain, inflamed gums, white spots on the teeth. And by the way, sometimes those white spots, they can turn into brown spots. Okay, because really what's happening is white spots are typically hypomineralized enamel. You know, enamel is supposed to be kind of shiny, glassy like glass. And when you get these white spots, it's becoming a little more opaque because it's becoming more porous. And then when food stains get in there, that's what kind of turns it dark or brown. And so you need to kind of have that checked. Not everyone becomes a cavity. I'll check it with the Explorer. We'll push on it. If it's not soft, we don't have to do anything. Sometimes it is unsightly, especially on front teeth, and people want us to do something regardless, which I'm perfectly fine with. And something else, you know, I don't mean the white spots on your teeth that maybe there's this thing called modeling enamel, where in some cases where people live in parts of the country where there's too much fluoride in the water, just naturally, you get these white spots. The other thing is if you have your teeth whitened, those white spots can kind of blend in, and so it makes it look like you don't have them. The kind of white spots we're talking about are not modeled enamel. They are That'd be the hypomineralized enamel. Okay, so that was the first 4. The next one we're going to cover is changes of color in your mouth. When you're brushing your teeth every day, which you should be doing at least twice a day, take a look inside your mouth to make sure everything's normal. Look at your cheeks, the top of your tongue, and underneath your tongue, and make sure there's no discoloration, lumps, or inconsistencies from day to day. If you notice anything unusual, book an appointment with me or your dentist. Now, I just this last week, again, a new patient. It's very interesting how a lot of these things become poignant. I was doing a clinical exam. We had x-rays. Everything looked good. This woman had great teeth. But there was a white patch of color on her lower left cheek, right beside and a little behind the last tooth. And there is this thing called candidiasis or thrush, which is yeast, and it should wipe off if you rub it. The white layer should rub off if that's what it is, but this didn't rub off. And so I've scheduled her for an incisional biopsy. I'm going to take a little sample of it. We'll send it off to the lab. Because leukoplakia, which is also a white patch, can be considered precancerous, can sometimes become cancer, and so we want to find these things out very early in the process and get people treated before it becomes a big issue. Okay, so leukoplakia, changes of color, and it's not just white. It could be red. It can be lumps or bumps that you aren't used to seeing, and you see your mouth every day. Keep in mind that I only get 2 cracks at you if I'm lucky per year. The other 363 days are up to you. So it's very important that you become kind of an advocate for your own care and take a look in there, and you'll be the first to notice these changes. Okay, so that was the first 5, and let's see here. Yeah, we're going to have room for time for another one before we go to a break. Number 6, canker sores. Canker sores can be quite common in some people. If your canker sore goes away within a few days, that shouldn't be a cause for concern. But if you have one that won't heal, you need to seek dental attention immediately. Likewise, if you're experiencing a high fever or persistent pain, you should book an appointment as soon as possible. Okay, why is that? Now, first of all, what's a canker sore? It's it's a little confusing. Sometimes there's this thing called an aphthous ulcer, which is most likely what you're talking about when you say canker sore. And what that is it's kind of a raised red ring, a little bit of a depression in the middle, and it hurts like crazy when you stick your tongue on it. And most people do that. This place hurts, and they go, let me see if that still hurts. So you put your tongue on it, it's like, oh, that still hurts. Well, it doesn't heal as quickly as it would if you would leave it alone. Keep touching it. The other is primary herpes. So if you get a crusting sore on the outside of your lip, that's typically primary herpes. And that can be treated with acyclovir or Zovirax. There are also some pills, tablets that we can prescribe for you to take, to swallow, that will make that go away quicker. And so, but keep in mind the reason that we're talking about if this doesn't go away is it could be one of those precancerous lesions, or maybe even already cancer. Okay, so it may not be a simple canker sore, and unless you're really well versed at knowing the difference, you should make an appointment and come to see me or your dentist. Okay, so that was number 6. Let's see here. You know what? I think it might be time. Let's go to a break. When we come back, we're going to cover numbers 7, 8, 9, and 10. You're listening to The Reasons We Smile with Dr. Kvitko, episode number 555, and we'll be right back.
You can't take me as I am, not just a little bit. I don't know who to be. I'm a paper cup, baby, you're the sea. I know you see it too, 'cause you're too much for me.
This is Clark Kellogg. Stay tuned for more of Dr. Kvitko.
Estás escuchando con Dr. Kvitko aquí en su estación favorita. Hi, I'm Dominique Reichert. Like what you hear? Why not use the show to promote your product or service by becoming a sponsor? Call 614-262-9588 to learn how. That's 614-262-9588. Call now.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. I've been honored to help several famous people get a perfect smile, like Keith Carlos and Dominique Reigard from America's Next Top Model, and Ted the Golden Voice Williams from right here in Columbus. Isn't it time you had a celebrity smile? It costs less than you might think, and most of the time, it can be done in one visit. A new smile can make a world of difference.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
I'm
Grandpa, and I go to Dr. Kvitko and I still have all my teeth. Real ones. Where's my glasses?
All right, if you're just joining us, I'm Dr. Kvitko. This is The Reasons We Smile, episode number 555. Today we are bringing you 10 signs you need to see your dentist as soon as possible. Okay, and I'm happy to be that dentist if you'd like. Anyway, okay, so now we're on to number 7, which is dry mouth. Dry mouth can occur for a few different reasons. Sometimes a dry mouth comes with age. It also is a common side effect of many prescription drugs, and over-the-counter drugs for that matter. However, there's no explanation for sudden dry mouth symptoms. It would be important to see your dentist because it could be a sign of a bacteria or disease in the mouth. Okay, so that was dry mouth. Number 8, headaches. Most people don't associate headaches with oral care, but the two can be very closely related. If you're experiencing frequent headaches, especially in the morning, you might be grinding your teeth in the night. Your dentist can provide you with a night guard, a mouth guard you wear at night, which should help alleviate your chronic headaches. Now, I want to clarify, and by the way, this happened this past week too. I'm just amazed that all this came in this last week. Of course, it is what I do, but still. So this person, they were referred by an emergency room. They went to the emergency room because they had such serious headaches, and the emergency room felt like they had done their differential diagnosis and couldn't find anything. And so they sent them to me. We took x-rays. We took a Panorex. Her condyles were perfectly fine, but I saw signs of wear, severe wear. And although I'd looked for cavities, looked for gum disease, looked for all those things we talked about, I could not find anything. It actually was TMJ disease, or TMJ syndrome. So we said, and by the way, you can't just get a boil and bite mouthpiece. It doesn't work. It'll make it worse. Okay? So we gave her exercises. We gave her a sedative to help her sleep more soundly, and we made her a bruxism appliance. That's the treatment. Number 9, bad breath. And if I'm talking fast, it's because I'm running out of time. Bad breath is one of the first signs of gingivitis. When left untreated, gingivitis can lead to periodontitis, which can lead to tooth loss and other serious health conditions. If you feel like you have bad breath, even when you're brushing regularly, you may have gingivitis. It's important to see your dentist immediately before this condition advances beyond the point of repair. And by the way, sometimes it's your spouse or somebody in your life that's going to notice you have bad breath before even you know it. Number 10, metallic taste in the mouth. Okay? Do you sometimes feel like you've just chewed a bunch of coins? Sounds odd, but a popular sign of gingivitis and possible periodontitis is a metallic taste in your mouth. The taste is very distinct and can lead to bad breath as well. If you're experiencing this symptom, call your dentist to make an appointment. The sooner you start treating the condition, the better the chances that it can be treated completely will be. All right, so that's pretty much all 10 of those. I want to, now that I know I'm not completely out of time, I can maybe expand a little bit on one of those. But let me just say this. I see so many people, and probably the most common answer I get from people when I say, you have external resorption, or you have periodontal disease, or you have an abscess. What is it? What do you think the most common response that I get from people is? And think about it, because you probably said it yourself. Nothing bothers me. I don't feel anything. Nothing hurts. Well, you know what? That doesn't matter. It doesn't matter. You still have infection. You still have pus. You still have... Oh, my goodness. Okay, so just keep that in mind. And if I could get people to stop saying, but it doesn't matter, it doesn't hurt, I would be so, so happy. And by the way, you would be so much more healthy. All right, so it looks like, I'm very close to being out of time. All right, let me just say this. That's all the time we have. Don't forget to follow me on Twitter. It's at Dr. Kvitko. Visit my office Facebook page and like us. That's Dr. Kvitko and Associates. Remember that all past episodes, complete with video, are available at thereasonswesmile.com. Be sure to tune in every week, right here on your favorite station. Goodbye.
This is Carly Red from Love and Hip Hop Atlanta, the hit show on VH1. urging you to tune in next week with my dentist, Dr. Kvitko.
If you're interested in learning more about this and other dental health topics, go to thereasonswesmile.com to access full episodes of Dr. Kvitko's show.
If you'd like Dr. Kvitko, the world's most interesting dentist, to speak at your next event, please call 614-262-9588. That's 614-262-9588, or send an email to speaking@thereasonswesmile.com.